So hello, everyone. It is just shortly after the top of the hour, so we're going to go ahead and get started with today's session. Thank you so much for coming to Deciphering the Social Media Pulse, Twitter's role in shaping COVID-19 health beliefs and vaccine perceptions. I'm Margie Shepard. I'm the I'm a coordinator from the National Network Library of Medicine, Region 3, and I'm going to be your moderator today. So since some of you might be first-time attendees to one of our webinars, I'm just going to share a brief few words about who we are and what we do. As the name suggests, the NNLM is part of the National Library of Medicine, which is part of the National Institutes of Health. We are the education and outreach arm of the National Library of Medicine. We work regionally, getting to know communities on the ground and helping those communities serve the people they know best. But we are also present across the entire country, and we work to advance the health and well-being of everyone through access and understanding of how to use health information. This includes both working with organizations like libraries of all types, schools, healthcare, and all sorts of community-based organizations. So we do this primarily through three different methods. We provide funding to organizations so that they can work within their own communities. Other forms are through outreach and engagement. And then, like today, we offer a wide range of training and educational opportunities. One recent new offering that we have put out there for the communities that we serve is the NNLM Discovery Podcast. Podcasts are available wherever you get your podcasts or on nnlm.gov/podcast. So I encourage you all to visit nnlm.gov to learn more. Today's session is part of the NNLM's Health Misinformation webinar series. Our series features guest presentations from expert guest speakers and will help librarians, public health professionals, health educators, and healthcare providers explore various aspects of health misinformation, disinformation, and malinformation, and to learn practical evidence-based solutions for how to identify it and help curb its spread. These presentations will be scheduled intermittently throughout the year, and you can learn about upcoming sessions by checking out the NNLM training calendar or by following your regional medical library's newsletter, blog, and social media posts. So it is my great pleasure to introduce our speaker for today's session. Dr. Yuan Lua is the Chief AI Officer at the Clinical and Translational Sciences Institute and the Institute for Augmented Intelligence in Medicine, and is an associate professor in the Department of Preventive Medicine at the Feinberg School of Medicine in Northwestern University. Globally recognized for his leadership and significant contributions to biomedical AI, Dr. Luan has earned the prestigious titles of elected fellow of the International Academy of Health Sciences, Informatics, and elected fellow of the American Medical Informatics Association. As a pioneer in the development of multimodal AI and data science frameworks, Dr. Luan's work focuses on understanding complex diseases and informing targeted therapies. His groundbreaking research has been featured in leading journals including JAMA, Nature Medicine, and Nature Biotechnology. Dr. Luan has given numerous keynotes to both academia and industry and has chaired multiple conferences and workshops. With a publication record of over 160 peer-reviewed papers, Dr. Luan, his work has been cited by scientists across more than 30 different countries and 25 research areas. Today, he will be presenting on Deciphering the Social Media Pulse, Twitter's role in shaping COVID-19 health beliefs and vaccine perceptions. So thank you so much for being with us today, and I'm going to turn everything over to you.
So it's a great pleasure to be here to talk about our recent work in terms of analyzing Twitter data in order to show the health beliefs, trends across the populations, and also see populations' perceptions of vaccines and what impact those perceptions. So as we all know, that the outbreak of the COVID-19 pandemic hit us in early 2020 and then lasted since then. And we know that every outbreak will be accompanied by not just this break of the disease itself, but also it will be accompanied by the outbreak of the information itself, as the director of the infectious hazards management and the World Health Organization has said. So it is our motivation to study what affects people's health beliefs around the topic of the COVID-19, and especially when it comes to the information propaganda that is spread on the social media platforms such as Twitter. And so the first thing is for us to define what is the health belief. And so especially around COVID-19, we categorize a few constructs that are core to the beliefs of people's perceptions around the topic of COVID-19. And they are four categories here. And one is the perceived susceptibility, that is the risk of getting COVID-19 infection. So as this example Twitter showed, that it gives an estimation of the infected people at a certain time, and that really triggers people's attention of how infectious the disease may be. And the second category is the perceived severity. So it's an infectious, very contagious disease, and then how severe is the case? And so as people's understanding gravitates towards the truth, then there are more and more statistics that comes out, and even in the social media, such a platform such as Twitter. And so in this example tweet, you see that the severity is expressed in terms of the deaths per day, and that is already exceeding 1,000. And the third aspect is the perceived benefits. And this one, you see there are different medications that people, and especially some of the physicians, even think could be helpful. And then there is different opinions about whether or not they were indeed helpful. And then around those topics, there is also the information, and some of those actually misinformation. And so you can see in this example tweet, it talks about a doctor in New York that has treated several hundreds of patients with 100% success. And as we all know, like by now, by our understanding, like retrospective understanding, this looks like misinformation. And then there's also the categories of the perceived barriers, and that include side effects of the drugs and affordability of the drugs and accessibility of the drugs. And also there are negative reports or the statements about certain medications. And so in this case, this drug has caused severe side effect and even resulted in fatal heart attack. And there's also house beliefs that are showing in the tweets, but they actually touch more than one aspect of those construct. It could be susceptibility plus severity, or it could be any combination of the four. And those are also quite frequent in terms of the what people tweet. And so we got interested in looking at all those data and looking at the trends of the four categories and how often are they mentioned. And so what we did is, of course, it's prohibited for us to annotate all of the tweets ourselves manually. So what we did is we annotated randomly selected subset of the tweets, and then we train our machine learning classifier. And this gives us a classification model that could tell the health belief model what construct the one of the four, and actually one of the five, and because there is the fifth category touches any combination of them, one of the classes that this tweet is about. And so this process is showing in the right figure. So as you can see, we have tens of millions of the tweets, and then after filtering and retaining only the English language tweets, we have about 500,000. And then we trained our classifier, and through manually annotating about 5,000 of the tweets, and that classifier gives us good enough performance, and that leads us to scale it out and to classify all of the tweets that we have. And as you can see, we have the most tweets focusing on perceived susceptibility and also perceived severity. And then to a lesser extent, benefits and barriers around the topic of the COVID-19. And the left figure shows the overall number and trend of each of the construct as we have categorized that's by our machine learning system. Questions up to this point? Okay, so now we could look at the trends themselves to a greater detail. And so we have found similar patterns occurs in the COVID-19 cases and the perceived susceptibility, which is shown in the left figure here. So in this figure, we show the number of the tweets, and those are the pink lines and the green lines in this left figure. We also show, and on the right axis, we have shown cases and deaths globally, and this is shown in the dashed and solid blue lines. And so as you can see, these earlier increases occur both in the perceived susceptibility and in the COVID-19 cases. And it seems that the increase in the susceptibility, perceived susceptibility, actually occurs prior to the surge in the COVID-19 cases, And we did an analysis of the correlation analysis and found that if we let the perceived susceptibility lead in a 3-day window, that gives the highest correlation to the surge in the COVID-19 cases. And so this is showing in the upper left in the right figure. And similarly, we found the dynamics of this COVID-19 deaths and the perceived severities also shows high correlation. And there seems to be a delay in this case in the increase of the COVID-19 deaths, and especially when you compare it with the number of perceived severity tweets. And by the similar procedure, and we found out the window of a delay of 6 days seems to be giving the maximum correlation, and which means that the actual deaths leads by 6 days for to the COVID-19 perceived severities. And this is interesting because in commonly used models for infectious disease, you can see that infection is considered to be highly contagious when the higher the R0 is. And the epidemic is harder to control when the R0 is larger. And so in this case, when we analyze if you see the kind of information spread and the multiplications in terms of all those health beliefs, the R0 is actually 7.62. And it is reasonable to conclude that the infodemic, as we put it, is ongoing in the COVID-19 pandemic. So it seems to go in parallel with the actual pandemic. And it's also interesting to see that the health beliefs involving perceived susceptibility, the increase ahead of the advance of actual involvement in terms of the cases. And because we observed the basic reproduction number of R0 of 7.62, this is suggestive of an infodemic. And these findings may suggest that the volume of the information regarding the COVID-19 affects the Twitter user's perspective regarding the risk of the infection. And in the early stage of the pandemic, before the mortalities were observed, it's actually also possible that less severity was assumed, and over time, this perceived severity may have increased as the number of deaths has accumulated. And this is an explanation that we think is possible for that -6 days of the difference between the deaths and the perceived severity curve. And so overall, we see that there is strong correlations between the perceived susceptibility and the perceived severities regarding the case and deaths. And this may suggest that the ongoing situation of the pandemic is a significant impact factor affecting the health beliefs back in the time of 2020. And then we look at the trends of the health beliefs models and the COVID-19. And then we were looking at some possible influences, and these could include the effects of the intervention, such as the lockdown in different states in the US. And then there's also a driver in terms of the public opinions, in terms of the major events that happens and that were tweeted on a platform. And those events, they can be categorized in general to scientific events versus those non-scientific events. And so the categorization of scientific events is that based on this, they are either based on scientific evidence or they are endorsed by authorities such as World Health Organization or FDA or CDC. And the non-scientific events is the other ones. And so we did a interesting analysis of the trend that are associated with those different events. And the first one that we looked at is the lockdown. And from the line chart that's showing here, we observed the dramatic increase in terms of the daily cases between the week 11 and week 14. And there was also an upward trend in perceived susceptibility starting from the week 11 time, and which began decreasing by week 13. And so this phenomenon is interesting because when we take the lockdown situation into consideration, this starts from, in general, starts from week 13, as those line charts shows. And those are aligned with the graph on the upper part so that the times are perfectly matched so that they can be made comparable. And so if you look at those, many of those states were under the government issued lockdown during the time when the when we observed the phenomenon. And so the official interventions were observed to potentially mitigate the general public's perceived susceptibility of the COVID-19. At the same time, we saw the growth of the number of the confirmed cases, they are slowing down during the same period. And interestingly, we didn't see a decline in perceived severity, even when almost all of the states were in on the quarantine mode. And previously, we showed that the perceived severity was found to most strongly correlate with the mortality. So we think that it could be that the lockdown policies did not ease the death concerns, and we still continue to see the death numbers rising up, and perhaps owing to the fact that lockdowns doesn't prevent the deaths, as we do not have a effective medication at that time. And so in this part, we show that for the first 3 to 4 weeks, this is actually a topic analysis of all the tweets that we tracked throughout the times. And we see that for the first 3 to 4 weeks, topics predominantly confirmed the cases over the world when the global pandemic was not yet affirmed by the authorities. And in the following weeks, we see that the terms cruise ship come into spotlight. And we know that in early February of 2020, a large and notable cluster of the COVID-19 cases, they occurred on the Diamond Princess cruise ship. And then during the week 9 and 8, the outbreak of the pandemic heightened in Italy and Iran, and then the topics related to those countries began to emerge. And on the March the 18th, then President Trump announced that there was he was taking hydroxychloroquine and as a prophylaxis for COVID-19. And that triggered massive discussions, of course. And in fact, starting at week 13, discussions involving the hydroxychloroquine and chloroquine began to dominate. And through this analysis, we suspect that the news from all the sources, some are from the scientific sources, some are from other sources like political sources. And the news from all the sources may penetrate into the discussions regarding the health beliefs and may influence people's health beliefs. And so the news that we consume every day may inadvertently be a substantial factor that affects our health beliefs. And this may contribute to and even exacerbate the infodemic on social media. And because what you digest is a great influencer of what you believe and what you will in turn spread to other people. And so this is something that's taken away. And we have done statistical analysis, and in this case, using Kruskal-Willis test, and to show that the scientific events and non-scientific events, they actually did not significantly differ from one another in regarding to their effect on the health beliefs within the given period. And we found it surprising that the scientific events did not appear to be significantly associated with the altering of the health beliefs towards potential treatments from our analysis. And this might be due to the public's distrust in science and arising from many uncertainties involving the pandemic in the beginning phase, or in the instances of being delivered conflicting information, such as when there were experts that some of them tell people don't wear a mask and some tell people to wear a mask all the time, and they are conflicting with each other. So this also has triggered some disbelief or distrust in terms of the sources from the scientific experts. And then to better cope with COVID-19 and similar future pandemic circumstances, everyone in the society, online or offline, should be aware of the overabundance of the information. And just remember the R0 of 7.6, that there's, even in terms of the contagious disease point of view, is highly contagious. And so this just shows you the kind of overabundance of the information and how they multiply and its potential impact on shaping the population's health beliefs. And so it is essential to be prudent, to screen the authenticity of all those informations that we digest and decide to pass on to others. And so this was our analysis for the early phase of the pandemic. And at the later phase of the pandemic, of course, we have medications, then we have vaccines. And so this also got our interest in terms of analyzing how the patterns of the changing sentiments towards vaccines from analyzing social media and Twitter data to see people's perception, how they change towards the vaccines, and especially with subgroup of the people like the pregnant women. And so we know that to fight against the pandemic, there are multiple companies that have developed vaccines that received emergency user authorization from FDA starting late 2020. And at the spring of the 2022, more than 11 billion doses of the vaccines have been administered across over 180 countries in the world. Discussions regarding the vaccines emerged even earlier and on the social media platforms than the actual administer of the vaccine itself. And the information traveled further and fast on the internet and social media, and including the news, commentaries, and personal feelings about those vaccines. And although previous studies have been published on sentiment analysis towards the COVID-19 vaccines, these studies haven't been systematic in the sense that most survey-based with limited sample size, and cohort diversity is also limited, and of course the time frame is also limited. And so in this study, we take advantage of the granularity of the user-generated data on Twitter and to investigate sentiments of the vaccines across many populations, and our time duration is 2 years, so spanning quite a significant time in terms of the pandemic, capturing all the major events surrounding the vaccine development. And in the study, we also address the gap of the disparities in terms of the vaccine sentiment across the different subpopulations regarding their racial, gender, and ethnic groups. And we use machine learning and deep learning methods to retrieve user characteristics that define those subpopulations, which I'll detail later. So the users generated Twitter data, we took them, and the subset of them was identified through a database called Tweet IDs. And that was developed by the Panacea Lab. And with those Twitter IDs, we go through a hydration process in that retrieve the entire tweet object by its Twitter ID. And then the date range of the extraction was from March 1st, 2020 to March 1st, 2022. And this covered the period where the topic of the COVID-19 vaccines initially drew public attention to the period where billions of the vaccines have already been administered worldwide. And the vaccine-related tweets were identified by regular expressions, and those tweets were analyzed in this study. They are all original tweets, and we exclude all those retweets. And we also analyzed only the English language tweets. And vaccine administration data in this study was obtained from the organization Our World in Data, and especially for the COVID-19 vaccine. And so for the pregnancy-related tweets, they were identified from the pool of all the COVID-19 vaccine-related tweets, and by regular expression to filter out for pregnancy-related tweets. And then the weekly data on the COVID-19 cases and vaccines among the pregnant people were obtained from the CDC. And since the pregnancy-related data provided by CDC are only available for the United States, for the pregnancy-related analysis, we also focused the tweets on the United States as well. Okay, so now let's move on to the methods. We track 3 demographic variables for the users of the tweets, and they include gender, age, and race. We were identified for the race was and gender were identified by the profile images using deep face package. And this is the hybrid face recognition framework wrapping multiple state-of-the-art models, as you can see here, RGG face, ARC face, and etc. And here's an illustration of how it works. So given a picture of the user, you can use the package that gives you a prediction of the age, of the gender, and race. And of course, this has to be legitimate profile images. So you can guess that if you give it a Pokemon Go cartoon, then it won't give you any useful information, right? And then for the age, we further stratify them into age groups that we will explain shortly. And races are classified into Asian, Black, and Hispanic, and White. And locations for each tweet were extracted and parsed into the location attribute in the user dictionary. And the location attribute is an optional free text generated by users. And this possesses a great degree of freedom. And we use the geoparser from the mod-sci package to parse the locations from those free text supplied by users to structured geographic information. And so this enables us to track the geolocations, to geocode all those tweets. And first, let's look at the temporal distribution of the tweets and fluctuations. So there are 2 panels in this figure. In panel A, it shows 7-day average daily counts of tweets of each sentiment overlaid with vaccination data. And those daily counts of tweets are shown in the negative, positive, and neutral sentiments by color. And the number of the vaccinations administered daily is illustrated in the purple shade in the panel A. And although discussions regarding the vaccines were initiated before the official vaccine rollout, more tweets were posted in 2021 after clinical trials for the vaccine started showing promising results. And this was around November of 2020. And we can see 4 arrows for both the positive tweets and the vaccine counts, which corresponding to 4 peaks in each of the distribution. And it's interesting that we note that the 4 peaks in the tweets were they predict improved vaccination rates, and they might provide hints regarding the effectiveness of the vaccine education. And in the table on the next page, I will show a list of the identified days corresponding to the peaks and associated events. And then the green vertical dashed line in this figure, so as shown here in the around between the December 01 and then the March 01 in the next year. So this green dashed line is the time point when positive sentiment started to dominate, as you can see. The positive sentiment is in the green curve, and the negative sentiment is, and the neutral sentiment is in the orange curve. So when the positive sentiment surpasses the neutral sentiment and then has taken lead since then. And so this green vertical line marked that time point. Although neutral and negative time point sentiments, they continue, but since that point, the positive sentiments have dominated. And this pattern could also reflect successes in the public health education regarding the vaccine's efficacy. And in panel B here, we show the fluctuation of the sentiments in tweets over time. And why do we want to track fluctuations? Because information can trigger the users of the social media to change their mind. And so sentiment changes. And in this case, we only consider when user sentiment switches between positive and negative or vice versa. And the count for the number of users with sentiment change in this figure were defined as the number of users who posted a tweet with positive sentiment on a given day, whose previous tweet was negative sentiment, or vice versa, changing from negative, positive to negative. And the number of users who switched to positive sentiments on a day is illustrated in the green area above the axis. And the number of the users who switched from positive to negative sentiments on a day is illustrated in the red shaded area underneath the axis. There are 2 outstanding peaks towards positive sentiments that can be observed in this figure. And upon detailed look, the first peak was on November 9th, 2020, when the Pfizer-BioNTech announced that the vaccine candidate against COVID-19 achieved success in the first interim analysis of their phase 3 trial. And the second positive peak is on August 23rd, 2021, and when FDA granted full approval to the first COVID-19 vaccine. So those are some peaks that you have most users change their opinions from negative to positive. But then there is also the opposite trend change, and the highest peak towards the negative sentiment was on April 13th, 2021. And so if you recall, that was the time when Johnson & Johnson has paused their vaccines after reports of the rare clotting cases have emerged. And so you can see that those critical events has a huge influence in terms of public opinions, even in terms of completely flip their attitude from positive to negative or vice versa. So these events that as we showed, as we alluded to in the previous slides, we show here are identified around the positive sentiment peaks. And this suggests the types of the events that may trigger positive sentiments around vaccines, such as fear vaccine uptake and scientific advancement. And similarly, events we mentioned just now, that are associated with sentiment fluctuations are also supportive of those arguments. And so it might be helpful to enhance positive vaccine education if more content of similar types can be promoted by influential accounts on social media. In the meantime, for bad news regarding the vaccine, such as the blood clot report of the Johnson & Johnson vaccine, we need more interpretable scientific evidence, and also we need more clarity when there is a lot of uncertainty that may cause the anxiety in a relatively quick amount of time. So to prevent the shift mindset from positive to negative. Now, this figure shows the distribution of the sentiments towards the vaccine by race, gender, and age. It's another hallmark of this study, addressing the gaps of the previous ones. And the distribution by race are shown in proportions in the top panel. And each sentiment panel indicates that the percentage of tweets from the given subpopulation. So for example, 22% for the Asian population, and in the negative subplot can be interpreted as 22% of all the tweets posted by Asian individuals were of negative sentiment. And the percentage are compared by pairwise proportion test adjusted for multiple tests using the FDR method. So you see there are pairwise links with the levels of the significance or non-significance denoted as NS in those figures. And as you can see, for the negative tweet proportions, the Asian population seems to be the highest, although the difference is small in terms of the percentage difference because there are a lot of people, so it could still be significant. And similarly, you see that white patients have the most positive tweets. White subjects have the most positive tweets on the vaccines. And so this is in line with the recent study published in Nature Communications showing that white individuals have lower vaccination hesitancy in multiple countries. And some populations of the different demographic features might have access to different resources, and due to various local policies that might affect their sentiments towards vaccines. But this racial differences in terms of their acceptability to vaccines, their sentiment to vaccines, that's definitely something that is worth paying attention to. And then the distribution by gender are displayed in the middle panel. While we observed that the same proportion of the negative tweets in male and female users showed a significantly higher portion of the positive sentiment towards the vaccines. There are multiple studies that show higher rates of the vaccines side effects among men than women, and this may contribute to the decreased number of the positive sentiments among the men. But on the other hand, there are also previous global studies showing that COVID-19 case fatality rates are also higher among men than women in most countries. So promoting the vaccines based on gender-specific scientific evidence could also improve the vaccination rate and protect the populations as needed. And then the bottom panel shows the distribution by the age group. You see that users aged 20 to 39 had significantly more positive sentiment towards the vaccine than the users aged 40 to 59. And so there is significant difference in sentiments towards vaccines between these groups, which might be due to the younger people's more openness towards the new things. But on the other hand, we didn't observe significantly higher difference in terms of the senior users that display the lowest and negative. Although they did display the lowest and negative and highest positive sentiment, the difference doesn't seem to be significant. This could be attributed to the smaller sizes of the population that we have collected during the tweet analysis. And for senior citizens, they are prioritized in vaccine administration in many countries worldwide, and this may imply the accessibility and availability of the vaccines also plays important roles in terms of shaping users' sentiments because they receive those vaccines, and many of them are protected from develop severe diseases. And so the sentiment in the senior patient groups is it is reasonable to see that they have the high positive sentiment toward the vaccines. So among all the 11 million tweets that are vaccine related, we found that 6 million of them had a location parsed, and this percentage of the positive and negative COVID-19 vaccine related tweets in each country are shown in this figure from the geocodes. And the upper and lower 5 percentiles of the percentage of each sentiment were removed since some countries or regions, they have very limited number of the users, and so the statistics may not be as robust. And the majority of the areas with the data available and are shown here, and then the areas without data available are shown in gray. And of course, we focused on English language tweets. So we see that some regions display mostly negative tweets towards the vaccines, such as Australia, Sweden, and Colombia, while other regions, they display a high percentage of positive sentiments and low percentage of the negative tweets, such as China, India, and Zimbabwe. But on the other hand, there are also regions that have demonstrated mixed attitudes towards the vaccines, such as the United States, Canada, and Brazil, and where we see equivalent shares of the percentages in terms of positive and negative vaccine-related tweets. And so this is something to very interesting to note, because policies regarding the COVID-19 vaccines among those countries and regions are all different. And then they also come along with various vaccine promoting strategies. And so by layering all those data and the result together, it's interesting to see that every country has their unique situation and with distinct culture and religion and economic status and vaccine availabilities. So vaccine plans tailored to each exclusive situations will likely improve the uptake in those places. And among all those 11 million tweets, we also identified about 100,000 of them that are pregnancy related, and of which about 23,000 of them have locations available and in the US. And this is what we focused. And given that the vaccine uptake data by pregnant women was observed by the CDC. And so in this figure, we compare the pregnancy-related trends with the situations in the general population in the U.S. And given the initial exclusion of the pregnant people in the U.S., we also focused the Twitter analysis on the U.S. populations. And you can see that the top panel shows the pregnancy-related analysis, and then the bottom panel, lower panel, shows the general population-related analysis. And you can see that the for the pregnancy-related analysis, we see the study period can be considered as 4 epochs, shown here in the different shade of the purple color. And the first one is pre-evidence-based recommendation stage. And the second one is efficacy publication stage, where you see those publication data. And then the third one is the recommendation stage. And the fourth one is the urgent action stage. And so it's interesting that you have this pre-evidence-based recommendation stage, because people remember that when those vaccines were out for clinical trials, there were initially no specific plans for the pharmaceutical companies to recruit pregnant women. And so as a result, the evidence regarding pregnant women has been a vacuum in the beginning phase. And so this has led to reluctances and hesitancies in taking the vaccines by the pregnant women, which will show later that how we can correlate that with some of the case numbers and then the vaccine uptake. So now back to the sentiment distributions in pregnancy-related tweets and the tweets for the general population, they actually show quite distinct patterns. So you see that there is a significant peak in the positive sentiments in the early 2021 for the pregnancy-related tweets, and this on average peak associated with the surge was on August the 11th, 2021, which is the time when CDC recommended COVID-19 vaccines for pregnant women based on new safety data. And on the contrary, the positive sentiment remained higher for the general population than other sentiments once the vaccines were granted EUA, emergency use authorization. And this happens at a much earlier stage than when the CDC announced the safety data for the pregnant women taking the vaccines. So you can see that there's a huge time gap between those two events. And ideally, we want there to be no time gap because you want the pregnant women to get protected, right? And once the general population receives this vaccine, evidence should also be solid and sound for pregnant women so that they can take the vaccines without worrying about any potential side effects to them or to their children. And when we look at the trends in COVID-19 cases among the pregnant women and then the general population, those are the pink lines in both the upper and lower panels. We see a bimodal distribution in both populations. The two peaks in the bimodal distribution of the COVID-19 cases in pregnant women, preceding the two peaks in the general population. And this may result from the less protection due to lower vaccination rates. And this again emphasized why we wanted to have the same amount of the evidence for safety for pregnant women when the vaccine is also being uptaken by the general population. And then the second peak of the COVID-19 cases among the general population is dramatically higher than the first peak. In contrast, the second peak of the COVID-19 cases among pregnant women is comparable to the first one, which may imply that the benefit from the increased vaccine uptake for pregnant women once the safety data has come in and when CDC makes the recommendation. So if recommendations could have been released earlier, then we think that the number of cases may have been further reduced, which is a pity that it is not the case in reality. But I think it's something that we should watch out for in the future and when future pandemics hit. And we also noticed that the peaks of the daily vaccinations of the two populations also differ. And for the general population, the peaks were found in mid-2021. And for the pregnant women, the peak is not until early 2022. And this may indicate more serious vaccine hesitancy among the pregnant women. And so timely evidence, again, recommendations based on those evidences for the vulnerable populations is extremely important in terms of improving the vaccine uptake and then protection of those populations. So in conclusion, as we have shown, we're not just fighting a pandemic, but also we are fighting an infodemic. And the dynamics of the pandemic and the information spread around this dynamic may influence the health beliefs of the general population on social media, and the user sentiment towards the vaccines is also not spared of this influence, and users can change their mind based on events or based on discussions of the social media. And there are major events along the development and distribution of the vaccines that appear to be associated with significant fluctuations in sentiments of the users. And then there's also significant differences in terms of the sentiment distributions were found among the users of different subpopulations with different socioeconomic status. And when it comes to vulnerable populations such as pregnant women, we found that the need for tailored guidelines or recommendations for specific populations that they could alleviate this vaccine hesitancy and subsequently improve the vaccine uptake. And another thing that we should also emphasize is that for the study of those vaccines, the pharmaceutical companies, at least in the future, they could consider different subpopulations when they recruit individuals for clinical trials so that they provide solid evidence for covering the entire spectrum of the populations that we wanted to protect. And so with that, I want to thank the audience for their attention, and then I'm open to questions.
Thank you so much. Incredible the amount of information that you shared with us. So we do have some questions in our chat. The first one makes the comment that Twitter uses demographics and content. Twitter user demographics and content have shifted dramatically since its purchase. What do you think this means for those of us using Twitter as a data source?
Right.
And then there's a part 2. What are your takeaways from thinking of Twitter as a case study in longitudinal public data? And do you have any comments on alternative data sources?
Right. So there are 2 questions, and so one is since the Twitter purchase by I assume that the question refers to Elon Musk, and so a lot of the things have changed, and unfortunately our analysis was also before the purchase, and right now it's really interesting to see how the landscape will evolve, but I think we have opportunities to overlay alternative data sources, which jumps into the second question. So some of the alternative data sources that we have explored, even in the second study, is the CDC's data, and also there are more and more hospitals that they are reporting their data and their surveys of social determinants of the health for their patients, and then their surveys on patients' attitudes towards the disease and towards the vaccine themselves. So those alternative data sources can be leveraged to at least for now overcome some of the shortcomings of the ongoing Twitter data. But on the other hand, I hope that the executive of the Twitter company will continue to pay attention to the previously valuable resources that the company has provided to the public health research community, and to continue collecting and then curating and then sharing those data to the research community.
We have another question. Is the utilization of tweets quantitative data as a research method more challenging to validate, and what ethical considerations should be taken into account in this process?
Oh, sorry, I missed the part on what is more challenging to validate.
Okay, so is the utilization of tweets quantitative data as a research method more challenging to validate, and what ethical considerations should be taken into account in this process?
Right. So in terms of the quantitative analysis of the tweet, I assume that it's the different kinds of the summary statistics and the trends that we extracted from the tweets. And so in terms of the validating that, I think you definitely need to overlay other data modalities. And so, for example, in the second analysis, what we showed is that by coupling the Twitter sentiment data with the CDC's report of the cases and the vaccination rate of the general population and the pregnant women, we can overlay them on top of each other to shed light. And so it's in analogy to where you specify the coordinates, right? So if you specify the X, Y, and Z coordinates, then you can pinpoint one point in the three-dimensional spaces. But then if you have only 2 coordinates, or if you have only 1 coordinate, then it's really difficult for us to pinpoint. And this is precisely the benefit of the multidimensional or multimodal data that can contribute with just the Twitter or social media data. You only have one coordinate, but with, let's say, the CDC's and even the EHR systems data, if you can triangulate them all together, then you have three coordinates that you can pinpoint on one exact point in the three-dimensional space. So I hope that analogy helps illustrating the point.
Thank you so much. Well, we've run out of time, but I do want to thank you so much for this very interesting presentation. And the evaluation link has been placed into the chat, and you can also see it on the slide. We will be sharing the slides for today's presentation later on, and we will also be sending you the link to the recording. So do check your email, watch your email for that in the coming few weeks. So again, I'd like to thank our expert speaker today, Dr. Luan, and I appreciate you being with us today and hope you can present to us again in the near future. So thank you so much.
Thank you for having me.
Yeah, thank you.
Thanks for watching. This video was produced by the network of the National Library of Medicine. Select the circular channel icon to subscribe to our channel, or select a video thumbnail to watch another video from the channel.